Welcome back. March is Colon Cancer Awareness Month. About 150,000 Americans are diagnosed with that disease every single year, and more than 50,000 people die from it. So on this Wellness Wednesday, Dr. Matthew Else from Utica Park Clinic is with us to talk a little bit more about colon health as well as screenings. Dr. Else, welcome back. Happy to have you.
Thank you so much.
Let's start with going through when someone should consider getting screened. Is there an age when someone should go in, or any symptoms that might show up?
Absolutely. An important fact actually is that last year we have changed the age of when we start getting our typical colonoscopies. So age 45 is now the starting age, previously 50. Now, if you were to develop any symptoms such as change in your bowel habits, any blood in your stools, or anything else, abdominal pain that we can't find the cause, it'd be a reason to consider getting a colonoscopy earlier. And then you also want to consider, if you have a family history, you would want to consider screening at least 10 years before that individual is diagnosed in your family.
So if that would be around 35 years of age?
Right.
Okay. What are some of the treatments that are out there to fight colon cancer?
Sure. So the best treatment is prevention. So I would recommend getting the colonoscopy. During that procedure, they can go in and take out any polyps that could potentially turn into cancer before it actually happens, and then your risk drops immediately. However, if we wait too long or if it advances too quickly, we would have to consider things like chemotherapy or radiation.
Are there things we can do now to try and prevent this, or is it just something that if it's genetic or it might just happen?
Sure. So there are 3 tests that we can consider. The best one by far is going to be the colonoscopy. Everyone's really afraid of it. It sounds horrible. It's not as bad as you think, but there's actually 2 other ones that if you absolutely do not want to get a colonoscopy, you can do a home test, and some of those are a 1 or a 3-year follow-up. However, if they come back abnormal, it's going to be recommended to get the colonoscopy.
I've never heard of a home test. Where would someone go to get one of these?
Yeah, you want to go to your doctor. You can't get it at Walmart.
Okay.
But it's just a simple collection at home, and then you send it off in the mail, and you usually have your results back in about 2 weeks.
Okay, but again, if you have family history or any of the symptoms, you probably want to go in to get the colonoscopy.
Absolutely, yeah. You're not a candidate if you have a family history of it,
and then,
personal.
Okay, and then do we know, does it affect men differently than women, or is it about the same?
It's about the same. So 1 in 23 men and 1 in 25 women will be diagnosed with colon cancer.
And it can be uncomfortable, like you mentioned, going in to get a colonoscopy if you haven't had one. Yeah. What is something you would tell people to kind of ease their nerves a little bit about that?
So the whole thing is you're not going to remember the procedure. They will give you some medication in order to not remember it. You won't wake up feeling anything. I always tell people the worst part is going to be drinking that stuff the day before that helps clean you out. And honestly, in my eyes, it's definitely worth it comparing what outcome could happen if we don't do the test.
Okay. Dr. Else, thank you so much. Appreciate having you again.
Thank you.